Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with fertility and pregnancy, P. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I decided to make several different video playlists so that it's easier to find videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I will be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, eyes, ear, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism, then remedies on infections, infestations in the immune system, then issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas and procedures and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue learning how homeopathic treatments can help with fertility and pregnancy, P. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes where they can congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position ready for birth. A full-term pregnancy usually lasts 38 weeks, counting from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods of the woman's cycle, is 28 days, and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tenderness of swollen breasts and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite or craving for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in every 6,400 pregnancies. Once it is determined that the woman is pregnant, it is important for her to go for regular prenatal checkups. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a picture of the baby in the womb, is thought to be harmless to mother and baby, and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of the sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal, or if there is a family history of congenital problems, or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise, such as swimming and walking in the fresh air, are very good, but anything that involves repeated compression of the spine, such as horseback riding or trampolining, should be avoided. Always keep 25% of your energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during labor. Don't wear tight clothes and get as much sleep as you can and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious travel if you can, especially if you have had a threatened miscarriage, or there are complications, or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so. So if you must fly, check with the airline first and stop working before 28 weeks if your work is very strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains. With generous helpings of raw vegetables and fruit will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the latter stages of pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medications if you possibly can. That means prescription drugs, recreational drugs, and over-the-counter preparations from drugstores and health food stores. There is no evidence that homeopathic remedies cause any problem during pregnancy, but to be on the safe side, they should not be taken in potencies less than 6C, except for tissue salts. It is probably best to avoid low-potency apis altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, see your doctor before taking anything. Piles during pregnancy. Varicose veins in the rectum and around the anus are related to constipation and pressure on the uterus on the veins of the pelvis. Specific remedies to be taken 4 times daily for up to 7 days. Remedy of first resort, Pulsatilla 6C. If Pulsatilla does not work and if piles are aggravated by drinking wine or coffee and you are constipation prone, even when not pregnant, use Nux 6C. Burning fiery pains in the rectum, soothed by heat, use Arsenicum 6C. Descending veins look bluish, burning pains after passing stools, Carbo Veg 6C. Anal fissures with cutting pains, use Chamomile 6C. Preeclamptic toxemia, or PET. Preeclamptic toxemia, or PET, is a complication of late pregnancy associated with raised blood pressure. In mild cases, there may be no obvious symptoms apart from raised blood pressure readings. In severe cases, the symptoms are headaches, blurred vision, intolerance of light, nausea, vomiting, and swollen ankles due to fluid retention. Protein may appear in urine. If the blood pressure is not brought under control, the symptoms of eclampsia, which are convulsions, drowsiness, and unconsciousness, may develop, threatening the life of the mother and the baby. Eclampsia is now rare thanks to better prenatal care, but PET is quite common, especially in first pregnancy. PET is routinely treated by drugs to lower blood pressure. In some cases, it may be necessary to induce the baby early. If convulsions develop or if other symptoms are severe, call 911 and give one of the emergency remedies that follow. The other remedies that follow are interim palliatives only. They are no substitute for expert medical care. Specific remedies to be taken every 5 minutes for up to 10 doses while waiting for help. Face hot, dry, and flushed, staring eyes, congestive headache. Use Belladonna 30C. Severe symptoms accompanied by great fear. Use Aconite 30C. Severe symptoms aggravated by grief. Use Ignatia 30C. Severe symptoms aggravated by fright. Use Opium 30C. Specific remedies to be taken 3 times daily for up to 3 days. Stinging pain in the legs aggravated by heat. Use Apis 30C. Feeling chilly, exhausted, and anxious. Use Arsenicum 30C. Self-help. The most sensible thing you can do is cut down on salt and rest as much as possible. I have a great many videos now on many different topics, and so I decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.